You are working with a client who is dealing with severe social anxiety. The client has expressed a desire to be able to attend social events without experiencing panic attacks. As part of your treatment plan, you decide to incorporate exposure therapy. Which of the following best describes how you would approach this? A. Immediately have the client attend a large social gathering and instruct them to interact with as many people as possible. B. Gradually expose the client to social situations, starting with less threatening scenarios and working up to more challenging ones. C. Suggest the client to avoid social situations altogether until they feel ready to face them. Or D. Ask the client to repeatedly visualize attending a social event without providing any further intervention. So, exposure therapy for social anxiety is typically done gradually using a fear hierarchy. The goal is to start with low-threat situations and repeat until anxiety drops and then step up. So this corresponds with answer option B. Again, gradually expose the client to the social situations, starting with less threatening scenarios and working up to more challenging ones. This is the essence of exposure therapy. So B is our correct answer. Now, in regards to the other answer options, starting with A, well, A describes flooding, which is often overwhelming and has much higher dropout risk, especially with severe social anxiety, as the client in this question has. So A is therefore incorrect. C suggests the client to avoid social situations altogether until they feel ready to face them. Well, this is recommending avoidance, which will simply maintain the anxiety via negative reinforcement. So C is essentially the opposite of what exposure therapy is seeking to achieve. So C is incorrect. And then D, ask the client to repeatedly visualize attending social events without providing any further intervention. Well, imaginal exposure is helpful, but it should be used to supplement. It's not sufficient as the sole intervention. So for this reason, D is incorrect. And once again, our correct answer is B.